What is syphilis? Syphilis is a sexually transmitted disease caused by the bacterium Treponema pallidum. In the early stages, the infection may cause genital ulcers or sores, mainly on the external genital area, anus, or in the rectum. Sores also can occur on the lips and in the mouth. If untreated, the disease can cause blindness and nerve damage. How is syphilis transmitted? Syphilis is usually transmitted through sexual contact with an infected person. An infected person can pass the bacteria from infected skin or mucous membranes, usually in the genital area, lips, mouth, or anus, to the skin or mucous membranes of a sexual partner. You cannot get syphilis from sharing food or utensils, or from using bathtubs, pools, or toilets. Syphilis can be passed from mother to infant during pregnancy, causing a disease called congenital syphilis. Many people infected with syphilis do not have any symptoms for years and are unaware that they are transmitting their infection. What are the symptoms of syphilis? Syphilis occurs in 4 stages that may overlap. The symptoms of syphilis depend on the stage of the disease. Symptoms of primary syphilis. Chancre. This is a small, painless, open sore or ulcer on the genitals, mouth, skin, or rectum that heals by itself in 3 to 6 weeks. Swollen lymph glands near the area containing the chancre. Symptoms of secondary syphilis. Skin rash frequently in the palms and soles, sore throat, tiredness, headache, swollen lymph glands, alopecia, or hair loss. Less frequent symptoms include fever, aches, weight loss, aching joints, or sores in the mouth or genital area. Secondary syphilis will seem to disappear, but the bacteria are still present in the body. Without treatment, the infection will move to the next stages. Symptoms of latent syphilis. In early latent syphilis, the signs and symptoms disappear, but the infection remains in your body. When you are in this stage, you can still infect a sexual partner or other persons with whom you have sexual contact. In late latent syphilis, there is no clinical evidence of the disease, and the risk of infecting a sexual partner is low or absent. If you do not get treated for latent syphilis, you may progress to tertiary syphilis, the most serious stage of the disease. Tertiary syphilis. In this stage, the bacteria will damage your heart, eyes, brain, nervous system, bones, joints, or almost any other part of your body. Late or tertiary syphilis can result in mental illness, blindness, deafness, memory loss, or other neurological problems, heart disease, and death. How is syphilis diagnosed? There are 2 laboratory methods for diagnosing syphilis: identifying the bacteria under a microscope in a sample taken from a chancre, or analyzing a blood sample. It can be very difficult to diagnose syphilis because symptoms and signs of the disease might be absent, go away without treatment, or be confused with those of other diseases. Visit your healthcare provider if you have a lesion or sore in your genital area or a widespread rash. Get tested periodically for syphilis if your sexual behaviors put you at risk for sexually transmitted diseases. If you have been treated for another STD, such as gonorrhea or HIV infection, get tested to be sure you do not have syphilis as well. How is syphilis treated? The best treatment for syphilis is with penicillin, an antibiotic that is injected into the muscle. If you are allergic to penicillin, you may be given another antibiotic to take by mouth. While being treated, you should abstain from sex until all sores are completely healed. You should also notify your sex partners and other persons with whom you have sexual contact so they can be tested for syphilis and treated if necessary. After you are treated for syphilis, it is important to have follow-up blood tests at 6 and 12 months and exams to make sure you are responding to the penicillin. Avoid sexual contact until the treatment is completed and blood tests indicate the infection has been cured. How can you keep yourself from getting syphilis? Avoid contact with the skin or infected tissue and body fluids of an infected person. Use condoms properly and consistently during sexual intercourse to reduce the risk of getting syphilis. To prevent passing congenital syphilis to their unborn babies, all pregnant women should be tested for syphilis. Keep in mind that syphilis is usually transmitted by people who have neither visible sores nor rashes and who do not know they are infected. Washing or douching after sex will not prevent syphilis. Even if you have been treated for syphilis and are cured, you can be reinfected by having sex with an infected partner. What are the complications of syphilis? Without treatment, syphilis can lead to damage throughout your body. In the tertiary stage of syphilis, small bumps or tumors called gummas can develop on your skin, bones, liver, or any other organ. If you are treated during this stage, the gummas will usually disappear. In the tertiary stage, syphilis can also cause a number of problems, including stroke, meningitis, poor muscle coordination, numbness, paralysis, deafness or visual problems, personality changes, dementia, and cardiovascular problems. What are the complications of syphilis during pregnancy? Untreated syphilis results in a high-risk pregnancy. Syphilis can cause miscarriages, premature births, stillbirths, or death of newborn babies. Untreated babies with congenital syphilis can have deformities, delays in development, or seizures, along with many other problems such as rash, fever, swollen liver and spleen, anemia, and jaundice. Sores on infected babies are infectious. To get more information, you can call Su Familia, the National Hispanic Family Health Helpline, at 1-866-SU-FAMILIA.